हं? पण नाही अजून कोणी नाही जॉइन. Good afternoon, all.
Good afternoon, madam.
Namaste, sir.
Namaste.
So today we are here to discuss a case on pneumonia. Welcome
Yes,
to
ma'am.
all for online clinical meeting.
Yes, ma'am.
And to present case, we have Dr. Alok Nikam. He is PG scholar from Guru Mishri Homeopathic Medical College, Jalna.
Yes,
So,
ma'am.
on behalf of Maharashtra University of Health Science, Nashik, I welcome to all for this meeting. And Dr. Alok, please share your slides.
Thank you so much, ma'am. Hello, everyone. My name is Dr. Alok Balasaheb Nikam. I am a scholar of homeopathic pharmacy, Guru Mishri Homeopathic Medical College, Jalna. Today we are here for discussing case of pneumonia. So we start. Preliminary data. Patient name is ABC, male, sex male, age 33, occupation restaurant owner, address Uttam Nagar, Jalna, religion Hindu, marital status married. Presenting complaints: high grade fever on and off since 10 days. Fever is 101 degree Fahrenheit, associated with chills and sweating. Cough with expectoration since 10 days. Character of expectoration is greenish yellow. Throat pain since 1 to 2 days. Character is soreness. Right-sided chest pain since 2 days. Character of pain is stabbing type of pain. Dyspnea since 2 days. Grade 4. Appetite is reduced. History of present complaints. Before the onset of symptom, patient was apparently healthy. Then he was suffering from fever on and off since 10 days. But last night there was a high-grade fever with chills and sweating. Cough with expectoration starts 10 days back. Right-sided chest pain since 2 days. Stabbing type of pain. Also, patient was breathless since 2 days. Unable to take breath properly. Onset is gradual. Duration 2 days. Breathlessness at rest. MMRC grade 4. Past history, no major illnesses. Family history, all family members are apparently healthy. Personal history, thirst 2 to 3 liters per day. Appetite reduced. Desire spicy food. Aversion, not specific. Addiction, alcohol and tobacco. Sleep disturbed due to cough and chest pain. Dreams, not specific. Stools, 2 times per day, satisfactory. Urine, 2 to 3 times per day. Perspiration, sole and axilla. Thermals, chilly. Constitution is tall, fair and robust. Physical examination, conjunctiva is pink, tongue pink and moist, nails pink, throat redness, pallor not seen, sclera white, lymphadenopathy not seen, edema not seen. Pulse rate is 112 beats per minute. Blood pressure is 120/80 mm of Hg. Respiratory rate is 23 breaths per minute. Temperature is 101 degree Fahrenheit. Oxygen saturation at room level without O2 94%. Systemic examination. Cardiovascular system. S1, S2 is heart normal. respiratory system. On inspection, trachea is centrally located. Chest shape is normal. Chest movements are reduced on right side. Use accessory muscles. There is no crowding of ribs, supraclavicular and infraclavicular following scenes. There is no any scar on skin. Increase respiratory rate. Palpitation. Trachea is confirmed to be central. Apex beat is palpated on left side. Apex beat is palpated on left fifth intercostal space on mid clavicular line. Chest expansion decreased on infected side. Increased tactile fremitus. Percussion all over clavicle resonant node is seen. Dull note on infected side. Other areas have resonant node is present. Cardiac dullness was seen on left of sternum. Auscultation. Normal vesicular breath. Breath sound are ausculted. Breath sounds are louder than normal. Cracks fine to medium. Over the infected areas, right middle lobe. Vocal resonance is increased. CNS, conscious and well-oriented, per abdomen, soft and non-tender. Differential diagnosis is pleural effusion, pneumonia, and bronchitis. Investigations: chest X-ray, right lung middle lobe consolidation is seen. Hemogram WBC is 11,700. CRP is raised 60 mg per dl. Sputum culture is gram stain positive. This is a X-ray. This is a chest X-ray. Consolidation is seen over here. This is CBC report. Final diagnosis is community acquired lobar pneumonia because the X-ray is showing only one lobe is affected. That's why this is lobar pneumonia. Thank you so much.
Okay, thank you. Hello. Nice presentation. Thank you so much. Now, from modern medicine, we have an expert, Dr. Santosh Kumar Singh. He is professor from Department of Internal Medicine, Armed Force Medical College, Pune. Welcome, sir. So you can share your slides.
Yes. Good evening to you all. Am I audible, ma'am?
Yes, sir. You are audible.
Yeah. So, just Dr. Alok, we have seen a case of pneumonia, which was actually presented by Dr. Alok. So, basically, in pneumonia, what is required and what is important, what we should know about the basically etiopathogenesis and how to approach a case of pneumonia. That is also it is also very much required by the doctors, the treating physicians, irrespective of their specialties. So I'm going to just in brief give you a glimpse about the pneumonia. So basically, infection of pulmonary parenchyma, which is characterized clinically or radiological signs of consolidation of a part or both lung. So this is the definition. And inflammation can be due to non-infectious cause also. It could be chemical or radiation also. So that we should know. Now, as far as the classification is concerned, it could be anatomical, where we have lobar, bronchopneumonia, or segmental, could be because of the causal, or the empirical classification could be because of community acquired pneumonia and hospital acquired pneumonia. Sometimes many patients, like in alcoholic and all, they may aspirate. So, or many patients in the ICU, the stroke patients, there may be accidental aspiration. So that can lead to aspirational pneumonia. So that is also very common, that we should also keep in mind. And one other category is immunocompromised host pneumonia. So clinical syndrome is, we may have typical and atypical syndromes. So in typical, in lobar, we may have patchy non-confluent, poorly localized shadowing, which is scattered, and there may be multifocal bilateral. So here we can see the lobar pneumonia. This again representing the bronchopneumonia. So as per the clinical syndrome, it can be either typical, 80% of them are typical, and 20% of them are atypical. So symptoms like patient may have fever, productive cough, he may have sign of consolidation, and X-ray will reveal consolidation. Like in the previous case, Dr. Alok has seen the patient was having consolidation. They may sometimes present with dry cough also, and chest minimal clinical sign. So always suspect a case of pneumonia. Okay. So now other thing was about the etiology. So you may have typical and atypical organism. So in 80% of the cases, the main causative organism is Streptococcus pneumoniae, H. influenza, Staph aureus, or in sometimes in 20% of the cases, patient may have atypical form like Mycoplasma and Chlamydia pneumonia. So now we should know the predisposing conditions. Because of reduced or suppressed cough, impaired mucociliary functions, macrophage and neutrophil dysfunctions, they all can cause this. Aspiration pneumonia, I already told you, these are the cause for aspiration pneumonia. And basically in post-surgical patients, patients on nasogastric tube, these things are more common. Can be inhalational also, like viral pneumonia or something like Legionella pneumonia. Then there are other mode of etiology like colonizations, blood spread, direct spread from adjacent sites, that we should always keep in mind. Now, how to investigate? So in nutshell, radiology like X-ray, sputum examination, CBC, we may have to send the blood culture of the patient. Then ABZ is also required in these cases. And of course, you need to consider HIV, pleural, or other serology also. Now, radiology, like that is a part of initial investigations apart from the clinical investigations, and the pattern may give you some clues. Like now, I am just few of the pneumonias I am just going to tell you where you'll have, like in Klebsiella pneumonia, you will have upper lobe involvement. In staph pneumonia, you'll have cavities. So here you can see this is one of the pictorial representations. Then here you can find patchy consolidation are there in the right lower zone. Then here also you can find in the right lower zone the patchy consolidation, right lower lobe consolidation is there. Here you can see it is mainly involving the upper lobe. So in Klebsiella pneumonia, upper zone is mainly involved. Then you may have nematocele in some of the cases. Here you can beautifully see the nematocele, and sometimes you may see staph pneumonia with abscesses. So this is the features of staph pneumonia with abscesses. Now for all the doctors, when to do X-ray? So it has to be done on admission and improve clinically, repeat after 4 to 6 weeks, repeat earlier if there is clinical deterioration. So this is again must know. Now when to do CT? So basically pleural effusion versus underlying consolidations, or if you find patients is having features of sepsis, that time you can go ahead with the CT. So here we can see in the CT bronchogram in posterior aspect and the lower lobe. This again CT picture, I'll not go into detail. Now coming to macroscopy, another modality of investigations. So here sensitivity is around 50%, and we have to send the cultures and for the gram stain and special stain when it is indicated. So these are the few of the microscopy which is seen, like in pneumococcus, this is the representations. For H influenza, this is the representations. For Staph aureus, it will be look histopath like this. Pseudomonas, it will be like this. Then serology is very important for the specific pneumonia. I'm not going into detail of this. Then sputum culture, pleural fluid studies, repeat blood cultures, that is also supposed to be done in case of pneumonia. Now, after the etiology, clinical features and investigations, now last part which I am going to cover is about the treatment modality that all of we should know. So in treatment, basically you may have community acquired, hospital acquired mycoplasma, staph, legionella, aspiration pneumonia. I'm not going into detail, but in nutshell, this algorithm say if there is marker of severe illness, send sputum for gram stain culture, urine for pneumococcus and legionella, and send the serology. And these are the markers of severity that we should also know as a physician. So if there is patient presents with altered sensorium, patient is having tachypnea, if patient is having hypotension, if hypercarbia is there, that means PaCO2 is on high side. So these are the indications when these patients will require admission in the ICU. So these are the marker of severity, and all of you should know when to admit these patients in the ICU. Then where to admit, like there is a curve criteria that we all should know. C stands for confusion, respiratory rate more than 30, if BP is low, and if the patient is falling into geriatric age group, that means age more than 65 years. The last part about the empirical treatment. So we, for the uncomplicated, we need to start with amoxi, and if staph suspected, then we can use clarithromycin or cloxacillin. Then other, then for these all are the antibiotic. I'm not going into detail. First generation cephalosporin, second generation cephalosporin that we can use. And apart from that, we have to manage the complications also. And duration of antibiotic should be for 7 to 10 days, longer for staph and all. Okay. So other measures like supportive therapy like oxygen, fluid, inotropic support, physiotherapy, these things are indicated. These are the poor prognostic factors. If the TLC is high, hematocrit is low, X-ray showing multiple lobes. So these are the last part about the presentation is complications that we should know. So parapneumonic effusion, that means the patient is having pneumonia along with effusion. Empyema, that means abscess. Pneumothorax, if there is air inside the cavity. Lung abscess, patient can go into ARDS, that is acute respiratory distress syndrome. So these all are the complications. And mind you, mortality, average 30-day mortality is around 13.7% in all these cases. So we have to take this thing in mind. Sometimes we may have hospital-acquired pneumonia, which occurs 2 days after admission, and these are the organisms. So modality of treatment remains same. I'm not going into detail for all these individual cases. So my take-home message is what I have covered in my lecture or for my small interaction today is you should know the etiopathogenesis and when to suspect pneumonia, what are the investigations which need to be sent, and what are the parameters or indices for severity of pneumonia and what complications pneumonia can arise. So with this short presentations, I have just finished my presentations. Any questions or any doubts you related with pneumonia, I am happy to take over this. Thank you very much.
Thank you, sir. Thank you for positive factors, pathogenesis, investigations, management, markers of severity, curve criteria, and all. In short period, explain details of pneumonia from modern medicine. Now, for Ayurveda side, we have Dr. Vishwajit Mehetre. He is Principal Professor HOD of Kai Chikitsa Department from Vasantdada Ayurved Medical College, Sangli. Vasantdada Patil Ayurved Medical College, Sangli. Welcome, sir. Please unmute, sir. Okay.
Thank you, ma'am.
Yeah.
Doctor from AFMC, he told very well about the pneumonia. The modern aspect is pneumonia, but in Ayurveda, if it is, if any medicine or if a new, you can say, entity or disease is not explained in our text, so it has to be considered as a new thing. So it can be correlated with the Kasa in Ayurveda, and it comes under the respiratory system, that is Pranavasrotas. So basic thing for this is an etiology. The causative factor is very important. The first thing is that either pneumonia, differentiation, lobar or interstitial, or it may be aspiration or community acquired, or it may be ventilation acquired or ICU acquired, irrespective of the cause. So according to Ayurveda, if you are thinking about the Kasa or pneumonia, it's a latter part of, it can be differentiated as a Kshataj Kas, or it can be correlated as a productive part, Kafaj Kasa. As far as expectoration is expected, we can correlate it as a Pranavasrotas. So if you are thinking about the Pranavasrotas, then I'm going to tell you this thing. Kasa is not only this thing. Yeah, I am going to add some slides. So etiology, hetus are considered, if as far as Nidana is considered or hetu is considered, the hetu is here, the most important is Vayu and Kapha, Udan Vayu. The specific sound of the cough, it is termed as Kasa. And the various factors had been described as per different types like Vataj, Pittaj, Kapha, Kshataj and Kshaj. You can correlate Kshataj Kasa as a part of expectoration with a rusty type of sputum, or expectoration along with the blood or hemoptysis. First thing you have to consider in mind that in Ayurveda it has been described as Nidana Parivarjan. That means you have to stick up on you have to sort it out the Nidana, and you have to treat or rule out the cause and treat the cause. So that is a very much important part of the treatment of Kapha. And here, respiratory system in Ayurveda, it is considered as a alimentary canal or alimentary system. It provides all these things. That means if you arrest the alimentary system, if you are doing Shodhana, then Pranavasrotas, Dushti or diseases can be prevented. It's a part of preventative factor, but we'll see the pathogenesis. The here important is Kasa, means respiratory system or coughing. How it occurs, it has been described, but the preliminary or predominant symptoms, are Pururupa are Kasana Kasa. That means if respiratory sounds, sound of cough, you can say. But there are different types of Kasa and the treatment of Kasa. But here you can consider it as a Pranavasrotas Dushti Chikitsa. If you are thinking about the Pranavasrotas, there are three parts. That means line of management of the underlying etiology, you have to rule out the cause and treat the cause. Number two, the diagnostic methods are depending on the symptoms of the disease. There are a variety, that is Vataj Kasa, Pittaj Kasa and Kafaj Kasa. Here you can correlate with the Kafaj Kasa. That means sputum with productive sputum. So that can be correlated as a part of pneumonia, productive cough. So Kafaj Kas or Kshataj Kas you can correlate, and that is the diagnostic method or diagnostic according to the clinical symptom, you can diagnose this thing. And if you are going to concern about the line of management, already sir had told that Pranava Srota Dushti Chikitsa. One is preventative part. Second part is giving treatment and apunarbhav chikitsa. So preventative part is to rule out the cause and treat the cause. Second part is to think about the treatment. So we think about the shlokas. It has been described in Charak Samhita that yat kinchit kapha vatagnam ushnam vatanulomanam vishajam panam annam tadhitam shwasikanam. So if you are thinking about the respiratory system disease, so you have to think about the shodhan, you have to think about the any treatment which is beneficial or which is going to cure the cough. That is very important. So it is the preventative aspect along with the curative aspect. So as far as curative aspect is concerned, there are some things, just like if you are going to give Akta Lavana Taila Snehena. That means if you are giving steam to the person, that may be helpful as an assisted coughing. As far as allopathic medicine is concerned, it is a kind of physiotherapy or assisted coughing, so that anyone can think about the expectoration. That means cough has to be removed. It's a kind of expectoration, and that will be helpful in the reducing the hypoxia. In case of pneumonia, if SpO2 is low and coughing is more, impulse is more, rate of respiration is more, so Akta Levana Taila Snehena, that is also useful. In if respiratory rate is more, you can also give Shodhana, that means Vamana. It has been described in the Samhitas. So Vaman is important, is a part of medical MSCs, you can say. That is also advised. Then again, there are some things that means simply hot water can be given. No doubt. Antibiotics are necessary if you are getting the bacterial infection. Nowadays, newer and best antibiotics are there. You can give culture, you can think about the culture and you can give the proper antibiotic. But along with that, you can advise the hot water for ingestion to the patient, because respiratory diseases are caused by Amashay Samutya, means stomach, they are originated from stomach. That is our concept. So that is very useful. Then as far as some kalpas are considered, Vasa, that means Adulsa, it can be given in the form of swaras, along with the some kalpas like Sitopaladi Churna for respiratory, and lower for lower Talisadi Churna, it has been given advice. There are two things. If production is more, then you can give some drugs like productive cough, Tunkan and Kapardik or Somalata Churna. But in case of non-productive or less production is that, you can advise the EST Madhu also. There are some drugs like Tulasi. Tulasi can be used as a viral, antiviral cases along with the supportive as far as this is concerned. Haridra is also useful. So that is a part of medicine which can be advised in that. And the most important is giving Snehan Swedan. That means masa steaming and oleation. Steam along with the oleation, it will be helpful in the assisted production. The last and most important part, we know that this is the line of treatment. Along with that, Apunarbhav Chikitsa is also advised. Apunarbhav Chikitsa means preventative aspect of the disease. As far as treatment is given after recovery, you can advise some Srotas Rasayan like Pippali, Srotas Rasayan, and the Rasayana which are helpful for the lungs, which can be also advised for that case. So that is Ayurveda aspect, and Apunarbhav Chikitsa is very much important as far as any respiratory diseases are concerned. Along with that, you have to avoid some diet part. That means if you are taking a curd or like these things which are going to secrete some secretions, more secretions, and which is going to increase the cold part, which is going to increase the cough. So that is not advised. It is called as Patha in Ayurveda. apathy in Ayurveda. And pathy is concerned, you can give hot water for drinking, and that is much important. Then third part of treatment or line of limitations. Absolutely, there are limitations. If patient is toxic, if rate of respiration is increasing, if the patient is not responding to Ayurvedic medicines, and the expectoration is more, hemoptysis is more, so it has to be shifted. If pleural conditions are there, chest pain is more, then you have to shift the patient to the ICU or for further line of management to the tertiary center. Although there are limitations, but we can give the take-home message for that is the Nidan Parivarjan, that means curative along with that preventative treatment. If you roll out the cause and treat the cause, then the treatment part is very important. For that, assisted cuffing or Snehasvedan can be given as a part of physiotherapy. Along with that, it is very useful for viral also, like Tulsi, Haridra, and some drugs which are helpful for that case. And lastly, Apunarbhav Chikitsa, that means you can also advise if you are thinking about the hospital acquired pneumonia, you can also advise Dhumapan. That means some sort of smoke is given with some medicines after that discharge of the patient. So preventative aspect can be also thought in mind or keep in mind. And for prevention aspect, you have to think also about the respiratory disease Srotosa Rasayan, like vitamin C containing Chyawanprash after the recovery of the patient, no doubt. Then Dhumapan also, and Agasti Haritki Avleha or Pippali can be given, which will increase the appetite, and thereby it can be useful in the kapha also. So that is the thing. As per as Ayurveda aspect is there. So we, with limitations, we can treat the patient well with this kind of medicines. If anyone is having any kind of doubt regarding Ayurveda management, so you can ask me.
Okay, sir. Thank you, sir. So
Thank you,
pneumonia
ma'am.
can be spread with Kafach Kasa, and
Yeah.
and thanks for Hetu Samprapti treatment part. Then limitations, most important. What are the limitations? Thank you so much, sir. We will discuss
Thank
this
you.
case later after Unani and homeopath expert opinion. So to discuss part from homeopath, we have Dr. Varsha Sharma. She is reader from Dr. G.D. Paul Foundation, YMT Homeopathic Medical College, Navi Mumbai. Dr. Varsha, can share your slides.
Ma'am, are the slides seen?
Yeah, your slides are visible, but
Okay.
you can make it.
Yeah. One. Yes. Good evening, all. Just now, Dr. Amol just presented regarding pneumonia. So I would just like to stress on the homeopathic approach, how we can go about in such a case, what basically is the scope of homeopathy in this case. Homeopathy will see to it that it initially resolves the inflammation, it will promote the complete and speedy recovery and prevent the complications and obviously prevent the mortality. This is what is the scope of homeopathy. And then now what are the special emphasis on the case that Dr. Alok just spoke, right? We'll have to see about the characteristic symptoms which we discussed in the case. We'll have to give more emphasis on the characteristic symptoms regarding the gradation of symptoms, the intensity of the symptoms, and the evaluation of the symptoms. And one very important thing that has to be noted is that the acute totality has to be framed in such a case. Now, what is the underlying etiology behind this case? The underlying etiology behind this is the weak immune system. The weak immune system of the patient is such that the patient becomes highly susceptible to the microorganism, to the causative organism, you can say. And hence it has an impact on the vital force, which is expressed in the form of signs and symptoms. And these signs and symptoms, which I just spoke about, the characteristic symptoms, which will help us in going ahead with the treatment of the case. Now, as this is a case, pneumonia, the pathology, when we see, it's a rapid pathology. And more or less, we finish the course quickly in a moderate time. Hence, as per the FOSM number 72, stated in Organon, the definition of acute diseases, this case falls under dynamic acute individual disease. Hence, it has to be approached as an acute disease. The totality of an acute disease has to be formulated. Now, when we are considering the acute totality, we need to think only about the morbid alterations. The alterations that are deviated. That which is the normal disposition of the person should not be considered. The deviation from the normal has to be considered, and which has to be taken for the acute totality, and present acute alterations should be considered, and the acute remedy has to be prescribed on those bases. So now once we come up with the Simlima, the second part is regarding the posology, the dose, what potency we have to give. Now potency has to be judged on 5 parameters. There's a susceptibility of the patient, the seat of the disease, the nature of the disease, the pace of the disease, and if there's any previous treatment. So based on these 5 points, we'll have to decide whether high potency is to be given or low potency is to be given. Generally, in acute diseases, we prescribe high
Slides are-
potency. Yeah, madam, yeah. We prescribe high potency in acute
Your
disease.
slides.
Yeah, ma'am. It was that slide. Then now, once we have considered the drug, we have considered the potency which has to be given, then we come up to the follow-up. How frequently we need to follow up such cases. As the pathology of pneumonia we know is life-threatening and rapidly spreading. Hence, we need to monitor these cases very closely. We have to keep a close watch for the warning signs and symptoms. As Sir just spoke about the CRUP, Singh Sir spoke about the CRUP criteria. The CRUP criteria have to be kept into mind and decided whether this patient has to be further referred for hospital or ICU admission. Hence, these patients should be followed up at regular and shorter intervals so that we can decide what has to be done, whether homeopathy still has a scope or do we have to refer it to a higher center. With this, I thank the MUHS department, Ayush MUHS department, Kalra madam, then Dr. G.D. Paul Foundation, my college, and the principal, vice principals of my college. Thank you, ma'am, for giving me this opportunity. Thank you.
Ma'am, just a request from our side that
Yes.
we want treatment and other special part from homeopath if
Definitely,
they are okay.
definitely. As I just stressed in the few slides of my 1 minute, that the treatment of homeopathy basically will decide. Yeah, 1 minute, ma'am, 1 minute. Yeah. Basically, the homeopathic treatment will focus on the characteristic symptom which we get in a patient. Then the intensity of the symptom, the uncommon symptom, the characteristic symptom basically means the uncommon symptom. We will have to find out what is uncommon in the common. So common symptoms like fever with chills, chest pain, cough with expectoration, these are common. Yeah. But we'll have to find out more characteristic. What are the uncommon peculiarity in those common symptoms, which will help us in prescribing. So the intensity of those symptoms, the modalities, the particular sensations, the tightness, the chills, if we have chills with fever, if there are any peculiar chills, what is there in the chill stage, if there's any thirst, if there's any deviation from the normal, as I said. Deviation from the normal means if there's any difference in the appetite, thirst, sleep, then these deviations are very helpful, which are known as concomitant symptoms. They're very helpful for us in deciding the Simlima. And again, as Dr. Alok presented a case with the right side affection, We have got various remedies in homeopathy which are specifying the right side affection, specifying the left side affection. So based on that, we have many remedies like Hipasal, Merck, Aconite, Bryonia, Lyco, Pulsatilla, Sulfur. There are n number of remedies which are given for pneumonia. But as I said, the characteristic symptom which differs from patient to patient will help us in formulating the totality. Totality of the symptoms is the characteristic totality and of the acute. That is the deviation from the normal, which has just come up, with the pneumonia, which has just come up since the disease has arisen. In the case which Alok presented, it was 10 days. High-grade fever, cough was there, then chest pain was there, dyspnea was there. So these things all will help us in formulating the acute totality, which will lead us to find the Simlimum. And the Simlimum, as I told you, Simlimum is the remedy. The remedy. And along with the remedy, the strength that we say, drug strength, that is the posology which we address in homeopathy. That is very important. So if the drug and the potency, these both things should match, which will help in the speedy recovery of the patient. So this is regarding the homeopathic management. Anything else, ma'am?
Yes, thank you so much, ma'am.
You're welcome, ma'am.
Expert opinion. Now to present from Unani side, we have Dr. Syed Rahman. He is Assistant Professor Yunus Fazlani, Unani Medical College, Kunzakheda, Aurangabad. Dr. Syed Rahman. Okay, I think he is not there. So now this case is open for discussion. So if you have any queries, you can ask directly to your experts. Experts are here with us. So forum is now open for discussion. Yeah. My question is for Ayurveda expert.
Okay, ma'am.
Hello. Just a minute. तुम्ही join. Sir, can we give Vaman to a patient of pneumonia?
See,
Which conditions we can give Vaman?
so it's a you can say woman is advice or emetic therapy is advice in case of Tamak Shwasa in our text because there is a dyspnea or rate of respiration is increased and difficulty in breathing is there. Sadhya woman we can give unless until there is cough with expectoration along with hemoptysis is there. Then you have to think the shamana treatment. That means you can't give woman for that case. Because I have seen simply if you are giving vamana, many of the children, if they are having bronchopneumonia type of symptoms, they get relief from the simply vomiting, cough along with the expectoration and vomiting along with the sticks of some sort of phlegm, you can say cough. That will relieve the some sort of inflammation and relieve the obstruction, you can say, and many patients get benefit from the Sadhya Vaman. You can't give Vaman as such because Nehen and all these things are there, Purva Karma. But Sadhya Vaman we can give simply, you can give Yasti Madhu font in a short quantity, and if patient is having a good kind of Vega or you can say vomiting or chardi like symptoms. Vomiting is there, then patient will get relief. And we have seen many of the patient with some sort of rate of respiration. If it is less, If it is more, then after giving Vamana, Sadhya Vamana, it is beneficial.
Acha. So, okay, if symptoms are mild, when symptoms are mild, we can,
Yeah.
but if there is severity in symptoms,
Yeah, we can't because we are having limitations.
chikitsa, right?
Yeah. Shaman Chikitsa, we are having good options. And
Yeah.
if a prana, definitely the bala of the patient, that means if patient is okay, health of the patient is okay, that means comparatively built is okay, then you can advise Paman. Otherwise, shaman treatment, most of the treatments are can be given in that case.
Okay. Thank you, sir. Thank you.
Thank
Any
you.
other
Thank you.
questions? Yeah, please ask. Here is one of the students from summer internship program.
Yeah.
Please ask.
सर जास्त जर लिव्हर अफेक्टेड असेल तर आपण आयुर्वेदाने पूर्णपणे लंग्स जर अफेक्टेड असेल तर करू शकतो का?
Sorry, please repeat the question. I can't hear. Ma'am can ask. Ma'am can.
Okay. So her question is, if lungs are affected totally, then what can be done from Ayurveda side?
Definitely, if lungs are all the lungs are affected, you can think this case like viral pneumonia in case of COVID.
So I think here is limitation for us, right?
Here is limitation. Here is limitation, but you can think about the assisted coughing. Assisted coughing, you can give simple Snehan Swedan so that breathing can be okay, along with the expectoration can be done. But there are limitations. If whole lung is affected, you have to think of shift to the tertiary hospital, tertiary center. Thank you.
Thank you. Any other question? So here is a complete discussion on the case of pneumonia. Thank you so much to all experts.
Thank you, ma'am.
Dr. Alok for guest presentation. Thanks to audience and thanks to all students. Thank you so much.
Thank you.
Thank you so much, ma'am.
Thank you.
Thank you, ma'am.
Alok. Thank you. So we will stop here. Again, we will discuss a new case on 1st and 3rd of Wednesday of every month. Till then, goodbye.
देवाला घालतात तिळाचं हा
बेल वाजली ना
सिरियसली एक तू एवढंच बोले प्रिया मीटिंग चालू होती ना
Yeah.